Hello, everyone. Welcome to A Healthy Gut Supports a Healthy Life. Hailing Sibo. I'm your moderator, Nicole. Before I turn this over to our wonderful team of providers at Philadelphia Integrative Medicine, a few announcements. To submit a question for our team at the end of the webinar, please use the Q&A button on your Zoom screen. Also, you will get a recording of this webinar tonight in your email tomorrow. For those of you who don't know, Philadelphia Integrative Medicine is run by a wonderful team of providers. Joining us tonight is Linda Sherland, Integrative Nurse Practitioner and our presenter. You'll hear more from her soon. Zoe Phillips, our Physician Assistant, and Dr. Georgia Tetlow, Integrative Physician. Before you hear from Linda, I'd like to introduce Dr. Tetlow. Dr. Tetlow founded Philadelphia Integrative Medicine, or PIM, 12 years ago, where we offer great care and teach and train others to offer integrative medicine care. PIM's vision is to empower, inspire change, and create trust with patients, PIM providers, staff, and the functional medicine community, and ultimately the medical community at large. PIM brings together the best of conventional and integrative medicine to give you tools to be well. Dr. Tetlow maintains a patient care practice as well as a mentoring practice for clinicians in transition to or maintaining phases of integrative functional medicine practice. She began mentoring healthcare providers in 2002 and pioneered a self-care curriculum entitled Honor Self. If you're a healthcare provider, please visit our providers tab on our website. Now, Dr. Georgia Tetlow.
Thank you so much, Nicole.
You're welcome.
I love your enthusiasm tonight. Nicole has been working all day, as has the entire team. Everyone you see here tonight, you can see Linda, who'll be presenting. Zoe is here with me, Nicole, and we also have another very important team member, Erin Arikar, our nutritionist. We've been working today, and that enthusiasm is very heartening. Thank you, Nicole. I'd like to prepare us just prior to transitioning to doing our meditation. We often do a centering before we start our talks. I'd like to just say each of us is finding ways to stabilize ourselves, finding ways to create safety, finding connections with ourselves, our bodies, and with each other. And tonight is an opportunity to expand our world. Sometimes our world is getting a little bit smaller in the ways that we're able to connect. So we're able to expand a little bit and open up our world to each other, and also to learn something new. We spend quite a number of hours preparing these talks, and we intend them to be available and freely accessible to the entire community. Our intention tonight is that you feel connected and that you also feel heard. You're in very good company tonight. We have between 500 and 600 registrants for the talk. And we don't do a lot of social media to promote our talk. These registrants and you come from real signups. So that means finding out about it yourself, or through a friend, or through a personal recommendation or a family member, and that means a lot to us. So we hope that you'll also remember to share and include others for our future talks, and we'll tell you about our next upcoming talk that's coming soon in November. Without further ado, I'd like to lead us in a brief centering. Just because we are on the screen and we've clicked the link doesn't mean that we've necessarily arrived. And so it's an opportunity to become more present and to check in and actually bring our mind and our attention where our body is tonight, so that we can receive, so that we can connect, so that we can feel that excitement that just came through from Nicole, which is that we all feel a lot of excitement sharing this topic with you, sharing our work with you. And we hope that this can be a standalone benefit to you, that you can receive a lot from this talk so that you can take better care of yourself, understand your body better, and also feel empowered, because this is about you and your choices really make the difference. So join me if you want to uncross your legs, if you're sitting, and find your feet on the floor. I'll invite you to become aware of yourself. So much to attend to around us. And beginning to become aware of your body, yourself, your breath. Taking a few moments to gather your attention, and we have control over a couple things in our lives. We have control over where we put our attention. Feeling your breath tonight in your body. Aware that you're breathing in. And letting go of any physical tension as much as you're able to as you exhale. So this is a safe series of moments. You're safe. If you're breathing, there's more right with you than wrong with you. So much more right with you. And if you're comfortable, if you haven't already, lowering your gaze or closing your eyes or continuing with eyes closed. Just seeing how you're doing tonight. How was your day? Where are you right now? Inviting yourself back to where your body is in this moment. To feeling your breath. Just breathing gently and compassionately. And just arriving back at home in you. And the present is where we can give and where we can receive, where we can learn, where we can love, where we can be changed, and where we can make choices. We can't do any of these things in the future or the past. So empowering yourself by becoming present, and so that you can receive the most possible tonight. Receive your own answers, and also receive some of the beautiful preparation and the slides and some of the laughter that we've prepared for you tonight as an offering. Breathing, arriving. It's our pleasure to serve you tonight and to interact with you. And we look forward to your questions at the end of the evening. And we're so glad that you've joined us. Welcoming yourself tonight. And beginning to wiggle your toes and wiggle your fingers. It might feel comfortable to actually stretch in any way that your body suggests. I notice that whenever I do meditation, I stretch my arms, I just naturally yawn. A little rest and digest input. So, completing our meditation. So, to further welcome you tonight, I'd just like to share with you our team. This is a picture of our team. And joining you tonight are the providers that you see on the screen, and Erin is right here to my right, important team member as a fellow provider. And you can see that we share a lot of joy and we love our work, and our intention is to be a healing environment and to interact with you in a way that is healing and integrating and empowering. So as integrative medicine providers, we are trained through the fellowship in integrative medicine through the University of Arizona, and also through the Institute for Functional Medicine certified practitioner program, and also through other curriculums. Our providers source functional medicine training from multiple sources. And our intention is healing-oriented medicine because we see you as a whole person. And you are a whole person, mind, body, and spirit. We also address, in addition to lots of specialty testing and insurance reimbursed testing that we choose in partnership with you, we also address all aspects of lifestyle and what can be important to actually affect outcomes, affect your vital signs, your blood pressure, your heart rate, your heart rhythms, any issues with bowels, bowel regularity, motility, inflammation, pain related to the intestines. And our intention is to really serve and address the source and root causes of all forms of chronic illness. So we address bone health, all forms of autoimmune illness, and certainly specialize in the thyroid function and understanding how the thyroid interacts with our hypothalamus, our pituitary, our adrenal system, and that our hormones, including our sex hormones, testosterone, estrogen, others, are a symphony, and they're interacting with each other, and they're affected by chemical messengers in our gut and in our brain. We are forming therapeutic partnerships and relationships with our patients all the time, and so we are available to you for, and really here for you as healthcare providers. Everything we do is informed by evidence. It's very safe to practice integrative medicine because integrative refers to the best of conventional medicine with all evidence-based therapies so that we can really be on the cutting edge and give you the best. And we believe that all people deserve the best medicine. So we combine the best of both worlds and offer all appropriate therapies that have been shown to improve your health outcomes and get you back to wellness so that you don't need us anymore. We'll be sending you the recording tonight. I know that's often a question that comes up in the question and answer. And we'd like to transition to a brief poll to ask you a few questions. So if you don't mind interacting with us and getting ready to go to your computer or phone, and we'll start the poll right now. I'll just mention the first couple of the questions, and then you can go through the poll on your own and focus. We're interested to know, are you a patient already? PIM refers to Philadelphia Integrative Medicine. That's our clinic. Are you a patient, or are you a prospective patient, perhaps? Someone who's considering being a patient. We'll give you a chance to read the questions. And all of them are yes, no, but as you travel through, the fourth question is actually a drop down. How did you hear about tonight's talk? And there are more and more healthcare providers that are attending our evening talks. So the level of understanding and explanation is also intended to serve all of us as the general public, as well as current patients and healthcare providers. The final questions have a little bit more to do with, have you experienced some of the specialty testing? And also I can see that the fourth question, how did you hear about tonight's talk? If you want to make any notes in the chat, if you don't have a drop-down menu for that, if it doesn't say social media or integrative therapeutics, or you're a current patient and we told you about it, how did you hear about tonight's talk? If you can put that in the chat, because I see that's just a yes/no question. It's not a drop-down option. So feel free to use, actually the chat might be disabled, so you can actually put any info in the Q&A, and then you'd be able to let us know how you found out about the talk. We usually wait until about 60% of folks have responded, and I think we're getting there. So I'm just going to ask my team whether or not we're getting close to the point where we can end the poll. So I'll just wait for a thumbs up to see whether or not we're getting there. Okay, so I'll just record our poll and then we'll transition. So just give me a moment. And our poll has ended and we'll just share the results with you. So are you a current patient? So 88% of you are not actually current patients. So only just a little bit over 10% are. So that's wonderful. That means that a vast majority of those joining are not actually familiar with our care or seeing us. We're not one of your healthcare providers. So we welcome you. And we're delighted that this is a way that we can introduce ourselves. And we may be introducing integrative medicine, or we may just be introducing how we do integrative medicine. But this is a wonderful topic for us to delve into. Are you a prospective patient? Are you a potential patient who might be interested in joining our practice? So 22% of you said yes. Wonderful. In terms of healthcare providers, it looks like there's lots of healthcare providers joining us tonight. It looks like almost 3/4 of our attendees are healthcare providers. So we have a special invitation for you. We are offering our next healthcare provider event. We do those monthly. Those are always free. Those are always online. And we're going to be telling you about the details of that. The next one is going to be, it's the next Monday of the month, and I'll give you the date, which is October 5th. 8 o'clock in the morning. So we have an international group of healthcare providers that joins us, so we can't wait to share that with you. We've had folks as far as Asia. So there it's 8 o'clock at their time and 8 o'clock in the morning our time, 8 o'clock p.m. their time. How did you hear about tonight's talk? We'll take a look at the Q&A and review that. I see that 33 of you have written in there. Thank you. And what percentage of you have ever had a comprehensive stool study? So it's almost about half and half. So I'm glad to see that some of the healthcare providers are getting some specialty testing. Sometimes we know about it and teach about it and provide care, but I'm glad that you're receiving care. And I know that some of our patients are going to say yes, because it's a test that's so helpful. And have you ever had a Sibo test? About 1/4 of us, it's a yes, and 3/4 of us, it's a no. So thank you so much for those answers. And I'm going to close out the poll, so hopefully you can see the next slide. I'm going to pass the baton over to my colleague who will be introducing Linda Sherland. So without further ado, I'd like to invite you, Zoe, to introduce our dear Linda, who will be presenting tonight, who will be learning so much from tonight, who's taking the stage and who's teaching. Please, Zoe, help me to introduce our colleague, Linda.
Absolutely. Thank you, Dr. Tetlow. I would love to introduce Linda Sherland, family nurse practitioner who has over 21 years of clinical experience. She received her Master of Science in Nursing at the University of Texas Health Science Center at San Antonio. Her extensive integrative medicine training includes completing the Integrative Medicine Fellowship at the Andrew Weil Center for Integrative Medicine at the University of Arizona in 2017, and coursework through the Institute for Functional Medicine. 3 words that I would use to describe Linda are grounded, intuitive, and connected. What I love most about Linda is that she takes time to truly connect with her patients, to understand their needs, and to support their well-being, body, mind, and spirit. She saw patients all day long today, and I appreciate her offering this evening, and I know you will too. So without further ado, here is Linda Sherland.
Thank you so much, Zoe, and welcome everyone. It's kind of exciting to hear how many healthcare providers are on the talk, and I saw that quite a few of you found out about this talk from Integrative Therapeutics, and we really appreciate everything that Integrative Therapeutics does to get the word out and to help to extend our invitation to everyone to show up. You know, got a slide here about what we're going to be talking about tonight: small intestinal bacterial overgrowth. And we're going to talk, I'm going to talk just a minute about the importance of a healthy gut and microbiome. In June, I did a talk on the gut, which is available on our website. If you want to go listen to that, a more general talk. We're going to talk what is Sibo, the causes and underlying factors, what sort of testing, and how we can be healing. One thing I like to think about as we're talking about this, that even though I've been treating Sibo patients for quite a while, every day I'm learning. Every day I approach this as a student. When I came to this talk, I was still listening to podcasts, and as I see the large number of healthcare providers, I think, we were talking about this in our provider meeting this morning, that I'm sure as I'm presenting this talk, there is someone writing a paper right now with new information that we'll read about in 6 months or a year or next month. And so one thing I've really learned about Sibo and gut health is to keep an open mind, to keep learning, to keep reading, to keep coming to talks. I just want to say I'm just very pleased to have you here tonight. We have a little disclaimer that I would like to share with you. This is an educational webinar. It's not a substitute for professional medical advice, diagnosis, or treatment. If you have questions after this webinar, that's what we're hoping. This will spark questions and ideas and thoughts, but please consult with a licensed healthcare provider and to address your medical concerns. And we're going to be talking a little bit about supplements. And we'd also recommend that you reach out to your healthcare practitioner before you begin a new supplement, especially if you're pregnant or nursing. The information is certainly not intended to diagnose, cure, or prevent disease. So one thing I'd like to plant a little seed here, and I usually do this when I introduce the topics, but I always like to start my patient visits, but I'd like to start here and just offer a, what are you wanting for yourself tonight? And as maybe you take a couple of breaths as we start to talk about this topic and think about what you're wanting for yourself. I think that always brings us inward and causes us to be able to bring information in when we realize what we're wanting. And then those things begin to kind of fill us. The importance of a healthy gut. Well, one, it certainly regulates the absorption of nutrients. It helps us process toxins and allergens intelligently. It acts as our second brain, which I think is so exciting. More neurotransmitters are produced in our gut than in our brain. So without a healthy gut, it's kind of hard to have a healthy brain. It also houses our immune system and acts as a gatekeeper for inflammation. It plays a large role in metabolism and weight management, and it processes and eliminates hormones. So it's very important that we care for this gut. And it's one of the things I love about practicing integrative medicine. I can remember being in family practice and did not have near the tools. And so very exciting to continue to explore this. Now, of course, my big question, we had this talk a few months ago, how's the poop? Quite a few years ago, I was practicing palliative medicine. And of course, when you're using opioids, you become very focused on poop. So although I'm not a physician or a doctor, one of my colleagues named me the poop doctor, and it kind of seems to have stuck, and I've learned much more. But I think one thing when we start about thinking about small intestinal bacterial overgrowth, we think about motility. And, you know, in that last slide, we talked about the gut is so important to detox. And as you look here at this stool chart, really the goal we're going for is the number 4. That's kind of that nice, smooth, soft, not squishy poop. It kind of just comes out very easily. And when you get up, you feel like you're done for the day and you're ready to go. And so we know when that's happening that we're flushing out, you know, all those toxins, letting things go. And so I think some things with Sibo and with the gut is about opening up and letting go. And when we're up here in 1, 2, and 3, you know we're kind of holding on. And so I think I love this chart, and it really helps us understand what's happening with our gut. So let's transition a little bit. What is Sibo? It's fundamentally a dysbiosis, so a bacterial or microbial imbalance that really is more in the small intestine. Maybe we have a lack of diversity, but generally it's because something's overgrown in the small intestines. Normally, between your meals, your gut moves. It moves the bacteria from the small intestine into the large intestine with the migrating motor complex. But if this movement's sluggish or as food accumulates, I tell my patients, it's kind of like the buffet for the bacteria that are in that small intestine. There can be bacteria, there also can be fungus. And so the food, not having been digested yet, there's plenty of nutrients there. So these guys just kind of party down. And what happens? Gas, bloating, constipation, diarrhea, back and forth constipation and diarrhea, nausea, acid reflux are some of the symptoms that we see. Left untreated, it can cause serious health complications and vitamin deficiencies, other symptoms that can arise. So things you might notice. Now, just because you have symptoms that we talk about tonight doesn't mean you have Sibo. That really we'll talk about testing, but you may have nausea, diarrhea, you're just not absorbing food well, feeling malnourished, losing weight, joint pain, bloating. Generally with Sibo, you're going to have bloating after every meal. That's pretty classic with Sibo. Maybe vomiting, weight loss, depression. Remember we talked about those neurotransmitters. You can see skin issues, rashes, acne, rosacea, fatigue. So there's going to be several slides that are going to talk about. So if you like to learn in different ways, especially when you go back through the talk, you'll see slides that kind of talk about these ways, the different symptoms and ways that we can see Sibo. So I mentioned that migrating motor complex. So the food basically is not moving. That controls the peristalsis from the small intestine to the large. And when there's a deficiency there, the food just cannot move. There can also be structural abnormalities. We're going to talk a little bit about those. Then altered physiology or function as well. Our next slide is just a chart. It's a wonderful chart. If you can advance that, Nicole. There you go. So this is Dr. Steven Sandberg Lewis, done a lot of work with the gut health. And so this is a chart, a great thing to have around, to especially you healthcare providers, you know, as you're thinking about this and looking. Just a wonderful chart. And I'm going to talk a little bit, I've got it kind of sectioned out here. So causes and contributing factors. And like I said, just because one or several of these are in place, it doesn't mean that you necessarily have Sibo, but we begin to think about clues. In integrative medicine, We're not here just to fix a symptom or to treat a symptom, but we're really here to think about the whole person and to put all of these clues together. So if you're thinking about yourself, or if you're thinking about a patient or a friend or family member, you know, it's like they have one thing on the list, it's more to explore. So things that impair mobility and slow that migrating motor complex: infections, autoimmunity, so hypothyroid, Hashimoto's, hypothyroidism, rheumatoid arthritis. There are many of our autoimmune diseases that can impair the mobility. Traumatic brain injury, and this is a really very interesting finding. I heard about this at a talk a few years ago. There's a psychologist, I believe in Massachusetts, that began seeing a lot of Sibo patients, and as she began to question them, began to find out about traumatic brain injuries. Now, the interesting thing about this is many of us, we don't think we've had a traumatic brain injury. We've just gone through our life, we've done our thing, we played basketball. Oh yeah, we ran into someone. Maybe someone played lacrosse. I grew up riding horses. How many times did I fall off? You know, and you've got that brain injury. Car accidents, even if it's minor, the brain slamming against your skull. So when you're talking with patients or thinking about yourself, think back, you know, did I play sports as a kiddo? Kids fall out of the bed, and that can be a brain injury that we don't think about, but it can certainly be related. And I like to talk about that a little bit more and go into a little more depth there, just because often people don't connect that. And I think it's something that's very important. Thyroid disease, hypothyroidism. Oh my goodness, hypothyroid, you're not going to get that number 4 if that thyroid is not in a nice, good, healthy place. Diabetes slows the motility, mold toxicity, and hypermobility disorders. We'll go to the next slide. This is more impaired digestion. So the first slide was some more of the causes. But when we think here, these are maybe some more of the symptoms or contributing factors. Belching or gas within an hour after eating. Heartburn or acid reflux. Bad breath. You're having trouble digesting your meal. You've got excessive fullness after your meals. Stomach pains or cramping. Undigested food in the stool, greasy, difficult to flush stools, are ongoing high levels of stress and anxiety. Next slide is impaired outflow. So these appendectomies, different sorts of abdominal surgeries, a gallbladder, even a simple gallbladder procedure. It seems so simple, but then can have more problems down the road. Hernia repair, other surgeries, gynecological issues or surgeries, endometriosis. Then there can be anatomical abnormalities of the digestive tract, such as blind loops, diverticulitis, superior mesenteric artery syndrome. And finally, medications. Different medications that can slow the gut: antidepressants, antispasmodics, opioids or narcotics, notorious, proton pump inhibitors or antacids. Cholestyramine slows the gut, antidiarrheal medications. So how are we going to find out what's going on? We use a Sibo breath test. We use the one and so, whoops, sorry. As you look here, the bacterial fermentation, we use lactulose, normally breath test. Occasionally we'll use glucose, but normally a lactulose breath test. The person fast, and then they drink the lactulose, and it produces gas. It can produce hydrogen gas. It can produce methane gas. There can also be hydrogen sulfide, and I'll mention that in a little bit. Then these gases are absorbed into the bloodstream and carried to the lungs. And the concentration is in the exhaled breath of the hydrogen or the methane gas. And so you're going to have breath test along the way. You're going to be breathing into a tube. It's a test. It can be done in a lab, and their gastroenterologists are ordering more and more of these. and they are, insurance covers those, but we do have a test that you can do at home. So then what do we see when we get a test back? Sorry, I just need a little bit more size here so I can talk with you. So when we get a test, we're going to see a graph that's tested over time. And so we have our initial test, and then every 20 minutes, from 20 minutes to 180 minutes. And you're going to see your hydrogen numbers, your methane, and you see over here there's carbon dioxide. So if there's a number everywhere here, that means your breath test was good, that every tube was filled with the air. And so what we're looking at is these numbers. So if we have our hydrogen that is greater than, Nicole, can you just go back to the test for a second? Because I was going to show here the hydrogen greater than 20 parts per million. The methane is greater than 12. And so these numbers are the preferred numbers to look at versus looking at the graph, because you can see here the numbers on the side can change. So we really want to look. We've also got, you'll see down at the bottom, this is where the lactulose, I'm sorry, is going through the small intestine up until 100 minutes. And then at 120 minutes, that's a transition into the large intestine. And so we want to see hydrogen and methane in the large intestine. There are bacteria there, and they're supposed to be making hydrogen and methane. Now you look at this test, and you've got your hydrogen, your methane is staying right flat along the bottom, but the hydrogen is going up over time. And you see that it's come up even before it goes into transition. So this is a hydrogen positive breath test. And so let's talk a little bit, now we can go to that next slide on hydrogen dominance. So I said we have hydrogen dominant Sibo, we have methane, and then we have hydrogen sulfide, which you did not see hydrogen sulfide on this test. The number one cause of hydrogen dominant Sibo is food poisoning. And the amount of gas that we see on the test where that curve goes up is not necessarily proportional to the amount of symptoms. So knowing you can have what would look like on the test a small amount of hydrogen dominant Sibo, but you may be having a large amount of symptoms. Generally with hydrogen dominant Sibo, we see more diarrhea. When we move to methane dominant, it's not necessarily caused by food poisoning. Trademark of methane dominant Sibo is constipation. So you're like above the ones, the twos on that stool chart. And so often though, usually the amount of methane is proportional equivalent to the amount of constipation that someone's having. And then when we look at hydrogen sulfide, and when we look at a stool test, all the lines are usually flat across the bottom. It looks like nothing's happened there. And that's because the bacteria that are making the hydrogen sulfide are using all the hydrogen and methane gas. Things that are characteristic of hydrogen sulfide: rotten, egg-smelling gas, diarrhea, the flat line on the Sibo test. The higher the hydrogen sulfide, often the more the diarrhea. So let's think about how we want to approach, and we use a 5 R's integrative approach to healing the gut: remove, replace, re-inoculate, repair, and rebalance. So when we think about removing, it's not about, oh, let's go in and attack and kill all the Sibo. We want to remove things like food allergies, or foods that folks are sensitive to. With Sibo, with inflammation in the gut, there can be a lot of food sensitivities. So we want to pull those foods out. Might consider elimination diet or some IgG food allergy testing. But what we find is as the gut repairs, the ability of people to eat more foods is expanded. But I've seen people come in, you know, maybe they could eat 3 foods when they came in, but as we treated, we can add more foods. Processed foods and food additives are very irritating. Alcohol, caffeine, those medications that we listed that can slow the gut, reducing simple sugars and carbs in the diet, and lowering stress. And you kind of see here, we haven't even gotten to the organisms yet. But these are all very important that we really begin to set that stage. And then there are herbal antimicrobials that we use, berberine, neem, oregano, peppermint, allicin, or garlic. These are all herbal antimicrobials that are very effective. And depending on the type of SIBO that we're treating and addressing, we would choose which of the antimicrobials. They're all prescription antibiotics. Xifaxan treats hydrogen, and then Xifaxan plus neomycin treats methane. And then there's also an elemental diet. An elemental diet is using a medical food and taking away all other food so that all of the amino acids are provided and calories are provided, but it causes the bacteria to die off that is overgrown in the gut. And it's, remember, we don't, in the small intestine, I'm sorry, what I was going to say, remember, we don't want to get rid of all the bacteria throughout the gut. We don't want to sterilize. We just want to lower what's happening. It's kind of like weeding the garden. You know, you go in and you pull the weeds out, but you don't want to make it where nothing can grow in the garden. So then we go and we think about the next thing we'll do is replace. And so we want to see those symptoms come down. And so we can use supplements to help replace digestive enzymes if someone's digestion is not working well. And in the last talk, I talked a little bit more about this. If you're interested in this, you can go look at that talk. Herbal bitters and bitter roots stimulate digestion. We also want to replace key nutrients that could be missing. Often we have B vitamins that might be missing. Zinc can be some of those nutrients that we're looking for. Something that is very important is our eating hygiene. And this may sound, you know, so simple, but it's chew your food. Chew your food until it's liquid. Eat in a calm, relaxed state. Eat sitting down. I'm married to a man who eats at the counter. Drives me crazy. Sit down. I even encourage people, you know, have a plate, set the table, and sit down. You see this family here eating with family, taking some deep breaths as you begin to eat, and in between your bites, not having no cell phones, no TV, no, you know, stressful conversations. It's probably not a time to address, you know, the kids' grades or those sorts of things. And then to not drink excessive liquids because that also lowers the stomach acid. Now we want to think about rebuilding. So we've weeded this garden, and you know, if you weed the garden, but you don't plant anything in there, what happens? You just get more weeds. Now, someone with SIBO has to be a little bit careful about this, and we're going to slowly reintroduce these foods as we're beginning to heal. So prebiotic foods, those are the foods that feed the good bacteria. So you think about if you had an overgrowth in the small intestine, remember I said that's like the buffet. You don't want to put a bunch of prebiotic foods in there because you'll have more severe bloating, gas, will not feel well. So this comes at the end of treatment. The prebiotic foods are non-digestible carbohydrates. Sources are dandelion greens, Jerusalem artichoke, garlic, cabbage, onions, leeks, asparagus. These are the great superfoods that are rich in prebiotics. And then we think about probiotic foods. Now, can we take prebiotics as a supplement? Yes, we can take probiotics as a supplement, but it's also great to get them from our foods. The fermented foods are the ones that are rich in the bacteria. Raw apple cider vinegar, sauerkraut that's fresh, not canned, it's got to be fresh, refrigerated sauerkraut, kimchi, beet kvass, organic plain yogurt. Thinking about fiber. This slows the digestion, lowers blood glucose, helps to maintain a balance of the blood sugar and cholesterol levels, makes you feel fuller for longer, also feeds that microbiome. Flax seeds, lentils, peas, chia seeds, berries are some of our great fibers. And then insoluble fibers that add bulk to the stool. They help promote regular bowel movements and therefore help remove the toxic waste in the colon. Grains and nuts, broccoli, cucumbers, carrots, green beans are all some of our great insoluble fibers, have those great insoluble fibers. Prevent and repair. So remember we talked about that migrating motor complex. We want that bowel moving, and that's another thing we do at the beginning of Sibo treatment, is to really make sure that the bowel is moving. There are prokinetics to stimulate that migrating motor complex. Some of the herbals are Iberogast, Motilipro. Prescription prokinetics would be low-dose naltrexone, Resilor. Dietary interventions, meal spacing. Have 3 to 4 hours in between each meal and trying to have a 12-hour fast between dinner and breakfast. Low Fodmap foods or a specific carbohydrate diet for 2 to 3 months. So these are diets. We have Erin Arikar, our nutritionist, that works with our patients on specific diets. These are medical interventions and they're a prescription. They're not something that you want to have long term. So again, a great reason to be working with a knowledgeable healthcare provider. Things that support motility. Magnesium, vitamin C are wonderful to keep those bowel moving. Visceral massage supports digestion. We make referrals to physical therapists that are doing visceral massage and pelvic floor work. Digestive enzymes, bitters, we're back to kind of that mindful eating, taking some breaths, moving slowly. These are supplements that help repair the mucosal layer. So when we have disruptions in our bowel and begin to have inflammation, so vitamin D, C, E, NAC, zinc glycinate, fish oil, L-glutamine, curcumin, Gastromend is an herbal blend. Hydration, so important. When you're trying to find that perfect poop, think about drinking water. Have you had 65 to 72, 78 ounces of water today? That could, you could be taking all the magnesium and vitamin C, but if you're not drinking, you're not going to be pooping too well. And then we think about healing foods, fruits and vegetables, bone broth. And then we talk about rebalance, having that healthy lifestyle, making sure that you're having enough sleep. 8 hours is fantastic. Movement, exercise, walking, more strenuous movement, yoga and Pilates are wonderful for bowel motility because they really work the core, and there are actually specific poses in yoga to really stimulate the bowel. Building resilience and lowering stress, meditation, guided imagery are things that I really love. Mindfulness practices. So this completes the talk tonight, and I want to again thank everyone for being here, and we're going to move in. We have another poll. I guess I can go ahead and just, if Nicole, if you want to put the poll up, we'd love to know, have you learned new information to enhance your health journey? We offer 20-minute consults. This is a chance for us to talk with you and you to talk with us. And so we're wondering if you'd like to be interested in scheduling that. You can schedule that on our website. It's really to see if we're a good fit for you, if you're a good fit for us. It's wonderful, I think, to be able to get to talk to a healthcare provider. Just wondering if after this talk, if you thought you might be interested in having a Sibo test. And also if you might be interested in scheduling an appointment. I'm going to kind of give you a few minutes to, thanks so much for answering our polls. These are really valuable and helpful for us. And we use this to make decisions about the talks we give and to bring information to you, blog posts, things on our website. I think we've got about that 60%. So I'm going to go ahead and Nicole, let you go ahead and end the poll. And great. Well, this makes me really feel good that 90% of you learned some new things tonight. That is very exciting. And that we have about 20% might be interested in a 20-minute consult, and about 18% of you thought maybe a Sibo test. And a few that are interested in appointments. So that's great. We just invite you to our website. So now I'm going to turn it over to Zoe.
Yes, thank you, Linda. Wonderful. All righty. So we would encourage you not to go anywhere, but to take some time right now and to jot down your questions. So use that Q&A button that you see on your screen and write down some questions that you have for us. We will be back to answer those questions in just a moment. We're just going to run through some really helpful announcements, and then we'll revisit those questions and spend a good chunk of time there. All right, so in terms of call to action, we would love for you to share PIM with your loved ones. If your life has been changed because of PIM, we would love for you to spread the word. We want everyone to know what it feels like to experience true wellness, and we also want to serve our community. If you enjoyed what you learned tonight, please sign up for a free 20-minute consult. This is a good time for us to talk about the things that are most important to you, your health goals and questions you may have about PIM and our approach, what a new patient visit might look like for you. Linda and myself do these free consults, and we really enjoy it. Again, check out resources, the resources page at philly-im.com for ways to create balance in your life, and also make sure to read our newsletter and stay up to date. Linda, I believe you wanted to share a little bit about our next talk. Linda, if you want to go ahead and unmute yourself.
I did. Thanks. So sorry. We're going to be November 11th. I'm going to be talking about insulin resistance and stabilizing your blood sugar for mood, balance, and longevity. Insulin resistance is something that we see very commonly, and the wonderful and great news about insulin resistance that it is can be managed with diet and with support and with lifestyle changes. And so we're going to be talking about those things. Insulin resistance is the precursor, if you will, to type 2 diabetes. And so the wonderful news is that we have the power to really reverse this and not have to have type 2 diabetes.
All righty.
And I'd like to just share, this is a great beginning to our webinar tonight, something that we have an opportunity to do, especially with so many healthcare providers here, which can really also elevate our discussion. And we'd love to hear from you, as some of you actually order and interpret and discuss these tests every day. Our question and answer is intended to be very rich tonight. So we're structuring our evening so that we can interact with you, and that's about to come up. So this slide we see in front of us is actually intended for healthcare providers, just very briefly before we come back to the full group, all of us together. And this is letting you know that on a monthly basis, we gather virtually. I mentioned this earlier tonight. It's usually the first Monday of every month. Our next will be Monday, October 5th, 8 to 9:30 a.m. We have a live session, which is now internationally attended by healthcare providers for the sake of self-care as an experience, not just to talk about it and name it, but actually practice it and to receive some of that self-care during the session itself. So one of the things that we remember is that the art of medicine really arises from the mind, body, spirit balance of the healthcare provider, in addition to the empowerment of ourselves when we're patients. And what we do is we gather and we have a brief centering, and then we have a particular topic and theme. And Nicole and I, we have quite a lineup. We prepare, and we have very rich sessions. It's actually my favorite thing to do. And it brings me great joy to connect with each of you. I will let you know that we have mentoring consults. There's a question in the chat, which I'll just take care of right now. If you are a healthcare provider and you're interested in learning more about the ways that we mentor and train you as a healthcare provider, there are consultations that you can have with me in order to learn more about what we offer, and also whether or not we're your next stop or something else is your next stop and your next step. The purpose of any consultation, whether or not it's a free consult as a patient or a free consult as a provider, is to help you see what your next step is. And that's what we want to support you in finding and discovering. And that's why we offer those free consults. I am also accepting new patients, although the free consults for patients might be scheduled with Linda and Zoe. They know that I accept new patients as well. I love patients. And what's happened more and more, we've always accepted healthcare providers as patients. You've actually come to see us as a patient. That's happened more and more in 2020, is that we've been sought out to be the healthcare provider for the healthcare provider. And that's something that we're very honored to do. We're very honored to care for all members of our community, especially those that are giving so much right now. We have an Honor Self Toolkit, which is intended for healthcare providers. If you want to be a patient or a layperson and you're not a healthcare provider, you want to check it out, we have an Honor Self Toolkit, which is free on our website and has a lot of resources that you can use. And what that does is it helps to give you the tools to see where you are with an assessment in terms of, do you feel like you're at the center of your life? And also some tools to help you get back to feeling like you're the center of your life. And those are very defined tools that have been inspired by the last years by talks at the Institute for Functional Medicine's annual conference. And so without delaying any further, we'd like to go in depth with your questions. We have somewhere between 20 and 30 questions to answer. And we've already been discussing who will be fielding what. Linda will be participating, Zoe will be participating, and so will I. And we look forward to interacting with you and to deepening this evening with you. So let's transition to questions. And I could get us started unless Zoe or Linda, you have something that you'd like to begin with. Okay, so one of our first questions really had to do with something from Anonymous. Taking a large number of vitamins and minerals in addition to many medications. And there's just a general question about resveratrol, which we haven't actually talked about tonight, but just to field that, and we'll transition to the other questions, which are a little bit more Sibo and gastrointestinal focused. Resveratrol actually has some good data about lowering inflammation and reducing blood clots. And that data is out of the Mayo Clinic, very reputable source. And there's actually a lot of other functions for resveratrol, which is a great antioxidant. It's found in red wine. And we know that red wine, sort of one glass, sometimes we want to drink more than one glass these days. But drinking one glass of red wine and getting resveratrol through food can actually have lots of documented health benefits that are well studied. And resveratrol is just taking that secret ingredient out of the actual thing that we're drinking. So we can extrapolate some of the effects there. And I'll also just answer a question that comes from Veronica. So Veronica is asking, is H. pylori and Sibo test the same? So H. pylori, first of all, those are two different conditions, but the question is the test for H. pylori and is the test for Sibo the same? So there's many different ways of testing H. pylori. There's blood tests, there's breath tests, there's stool tests, and there's other tests. So the test that we rely on is a PCR based, which is a computer generated. It's searching for the DNA from H. pylori, and we look in that in stool. So we use a comprehensive stool analysis to detect the presence of H. pylori. That's very specific DNA signature. So if you find it, you can see how many copies and what amount of H. pylori. And also an H. pylori is a stomach parasite for those of you who are not aware. And so if you have H. pylori in your stool, that means that it's traveled all the way from the stomach, through the small intestine, all the way through the large intestine and out for your stool sample. So that means that it's present in sufficient quantities to be detected by that computer, PCR computer, and that's present. So that's a comprehensive stool study that will detect H. pylori. And we treat H. pylori, and we try and treat less invasive but effective methods. So there's antibiotics and other botanical methods that are proven effective. And we have a lot of experience resolving H. pylori. And the Sibo test that Linda reviewed, that's an evidence, both are evidence-based tests. A Sibo test is different. A Sibo test is just looking at gases, methane gas, hydrogen gas, and also extrapolating the possible presence of hydrogen sulfide gas, which is showing a flat line, as Linda mentioned. That's using a substrate, and as Linda mentioned, it's looking at the presence of gases in your breath. That's not necessarily, that Sibo test will not tell you about the presence of H. pylori, so you're not going to get an answer from that. Those are two different. And I'll hand it over for if Linda, you're ready for a question, or if Zoe, I know that you were thinking about answering. Sorry if I took one of your questions, Zoe. I'm just seeing that. Sorry about that. I got my notes confused.
Oh,
So if you'd like to take a question, maybe Mark's question or whichever one you're comfortable with.
sure. So we have a question from Mark that says, is there a relationship with Fodmap sensitivity and dysbiosis, or Sibo? And I would answer that with a yes. So what is Fodmap? So Fodmap stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. And those are short chain carbohydrates, and they're poorly absorbed in the small intestine. So low Fodmap diet typically works well short term for Sibo or for other sorts of dysbiosis, because those high Fodmap carbohydrate foods, they can ferment in the gut and feed and exacerbate that small intestinal bacterial overgrowth. So that's typically why that sort of diet is helpful. Certainly not something that we would recommend long term. So hopefully that helps with that question, Mark.
And I'll go ahead and take the question from Rebecca. It says, if a patient has much dyspepsia and not relieved with DGL chewable 4 times a day and ulceration is expected, do you suggest H2 blockers? PPI decrease acid so much. I'm hesitant to use, albeit it is efficacious. The patient has been referred to gastroenterology, but awaiting an appointment. Well, and I think that's where we have stool testing. You can use H2 blockers. There are other herbals. There is other things that we use as well to help support these patients. But it sounds like definitely testing is in order to see what the root cause is.
And I can also add to that, thank you, Linda, and just say that we really want to involve all members of the medical team. So we need our gastroenterologists on board. Sometimes we're going to need an endoscopy or colonoscopy, and we're going to need a biopsy, and we're going to need to see some additional, actually a swath of tissue to look at the pathology to see presence of inflammation, the possibility for celiac or gluten sensitivity spectrum. And so I think also one thing that we want to be aware of is PPIs, proton pump inhibitors. They're very good at suppressing acid and working with those acid pumps. And that's going to help if someone has excess acid in a short-term approach, but in a long-term approach, we need our stomach acid to protect us as an immune barrier and also to be able to absorb our food adequately, to create adequate bone health, and basically nutrient absorption. So a PPI can be very helpful for symptom management, but DGL is something which is also treating symptoms, and it's trying to, deglycerinated licorice is something that is often used as a reflux treatment in an integrative approach. But we really want to know why. What is the dyspepsia caused by? Is it a motility issue? Is it a dysbiosis, a microbial balance issue? Does it have to do with eating habits? And does the person actually sit down and relax when they eat? Or they always focus on something else or standing? Are they a mindful eater? And these are other considerations, because we don't just want to throw DGL or proton pump inhibitors at our patients. They're also helpful stopgaps, but we really want to look into what's happening with our patient and those causes. And that comes out in the context of history, physical exam, and appropriate testing. Great question. Thank you, Rebecca.
So we have a question from Maureen. It maybe just went away. It said something about, I didn't get to read the question. Oh, there it goes. When someone has both methane and hydrogen elevated, which one do you treat? Since Xifaxan works best for hydrogen dominant and Xifaxan with neomycin works best for methane. So if you've got your Xifaxan and neomycin, you're going to be treating both. Now, the one interesting thing that can happen, you can treat the methane and then repeat the test once you've done a course of Xifaxan with neomycin, and you might still see hydrogen in your test. And then you would need to treat again, either with the Xifaxan or with a different antimicrobial, thinking about also making modifications in diet as well, and making sure that that bowel is moving and the stool is moving. This is where, when we have persistence, we really think about our physical therapists that are doing visceral massage. And so, but it's an interesting thing that happens with the methane. It may take up a lot of the hydrogen, and then you'll see that hydrogen still there. It doesn't mean that you've done anything wrong. You just need to be persistent.
It looks like we have a question, 2 questions from Linda. She asks, let's see here. What is the difference between Sibo versus dysbiosis? And then she then goes on to say, are treatment for Sibo and dysbiosis the same? Are they the same? So that's a great question. You've heard us say both in tonight's webinar. Dysbiosis just simply means an imbalance in the gut microbiome. And Sibo, so this is an umbrella term, and Sibo could be within that term, just as well as leaky gut, or H. pylori, or an opportunistic bacteria like a Pseudomonas overgrowth or Candida, all sorts of different things that can create that imbalance, that dysbiosis. So they are separate. And then the treatment, of course, is going to be different depending upon what we see. And we can use different tests to identify these areas of dysbiosis. We like to use a stool test, which can be really helpful to look at the good bacteria, bacteria that shouldn't be there, parasites, worms, some of the other things that I mentioned. Really comprehensive, and gives us the data that we need to pinpoint that dysbiosis and specify that treatment. But like Linda said, for Sibo, we do use a breath test. So those are going to be 2 separate tests. And Dr. Tetlow?
And I'd like to answer the question by B. George, and also answer the question about favorite antimicrobials for Sibo. So B. George is asking, what are your thoughts, practices on the prevalence of repeat Sibo in patients? So this may be coming from, and so many of our patients have had repeat Sibo. They've actually been diagnosed, treated, and they're here because they have it back again. Or you may be a healthcare provider that sees this and wants to really get to the bottom and serve your patients better. So that's why we spend so many slides looking at the root causes for Sibo. And that's because if you don't address why you got it, and you just treat the microbial imbalance, you're going to develop the microbial balance again. So Linda has mentioned in the talk and also in the Q&A about the importance of visceral massage. So visceral massage, for example, if you have a reflux of the ileocecal valve. So for those of us who are just orienting to the anatomy, the end of the small intestine, the beginning of the large intestine, is that ileocecal valve. And even if you've heard it tonight, I'll just say that again. And that valve can sometimes be dysfunctional, and it can reflux and allow all that colonic bacteria, where we want bacteria, to go into the small intestine. And you can see that on the test. You can see that the late small intestine, and just as you're transitioning, you see lots of increases in gases. which means that there's a reflux or there's an indication or indirect indication of a reflux of the bacteria in the wrong direction. So if you don't address that with some of the fascial pulls and some of the visceral manipulation that helps to restart and reset that ileocecal valve, for example, with a physical therapist who's trained in those techniques, then you're going to get a reflux occurring again, and you're not just going to be able to throw antimicrobials or antibiotics at your patients and expect for it to go away more permanently. It's not going to go away more permanently because the issue is a reflux, or the issue is motility, or the issue is another cause that hasn't been addressed. So taking that time to really identify the differential for where the SIBO comes from is really important. In terms of the other question from Anonymous, and that is about favorite antimicrobials. So Linda mentioned a few things in her talk, and she mentioned berberine, which is also great for normalizing blood sugar. We use that a lot for metabolic syndrome in our patients. She mentioned neem from the neem tree. I studied neem when I did my Ayurvedic training in '95. Oregano, she mentioned, and oregano has a lot of data for being a biofilm interrupter. Some of the bacteria in the gut, for example, Pseudomonas bacteria, has a biofilm around it. And you need agents that actually break into the biofilm to be able to clear some of those unwanted gram-negative bacteria that are really not intended to be overgrown in the gut. They're not the beneficial bacteria that we are normally housing. Peppermint, she mentioned, allicin, which means a key active ingredient in garlic. And I would also mention that we constantly use caprylic acid, which is also a very helpful antifungal. And the list goes on. Probiotics can also, used correctly, and the correct probiotics can be also helpful for SIBO and don't necessarily cause SIBO. Sometimes we're told, don't give probiotics, those are extra bacteria, you already have too many. But actually, it's really important what type of bacteria. So sometimes we're reintroducing bacteria that will balance and get rid of, weed out. I'm not sure how much we get rid of or rebalance those extra gram-negative bacteria with beneficial bacteria. That can be very important. There's bifidobacteria that are really helpful for SIBO, and we use those all the time. And also some of the things that Linda mentioned to replace digestive secretions and to help with motility and that migratory motor complex. She mentioned things like herbal bitters and like iberogast and motility activating supplements like artichoke and ginger. Those are also treatments for SIBO because they're addressing motility. And if motility, as it is often is in SIBO, a root cause issue for causing the SIBO, those treatments are replacing needed agents, but they're also helping to treat root causes.
I think another thing that I want to mention, if you're having a really persistent SIBO and not having things cleared out, it keeps recurring, maybe think also about looking at other systemic illness, environmental exposure, heavy metal exposure, some immune dysregulation, or maybe even some sort of stealth infection, Lyme, or co-infection. So finding that differential and just continuing to look for the root cause. And so sometimes, and it can also be fungal in nature, and we can have small intestinal fungal overgrowth as well as fungal overgrowth in the large intestine. So if you're continuing to have symptoms or persistent breath test, it bears more investigation.
I am loving the questions. And Zoe, if you see a question, Lynn, if you see a question, I'm noticing that we have 28 questions. And so sometimes we might be combining some of your questions. I think we've addressed biofilms. We also use other agents to break down biofilms, but you don't want to overdo the biofilm disruption for your patients because we need to make sure the garden is in place. And biofilms are not all bad. We have a natural biofilm in our gut. We want to disrupt the biofilm around pathogenic bacteria, but we don't want to disrupt the healthy biofilms, which means that there are layers as nature intended, that it's not just the raw naked epithelial layer or single layer of cells in the gut epithelium. There's layers that are protecting, and there's also a mucus layer, which is some bacteria are very important to promote that healthy mucus layer where some of your antibodies are there as a layer protecting you. For example, Akkermansia is an important bacteria that helps to create that mucus layer so that also people will have less pain and less symptoms if they have that Akkermansia bacteria and that mucus layer.
So Veronica had a question. Is there a timeline associated with the 5 R's? Is it realistic to do only one step at a time? I think that always depends on the patient and on what you're treating. The 5 R's are really, you know, a guideline, but you may start with one, but you notice, like when you saw remove, there are things that you can be removing and repairing at the same time. So I think that's very individual to the patient, to the situation, and what's happening. You may need to heal some inflammation before you really go after and want to treat more bacteria. You may want to have that digestion going much better, or motility. And so that's really not a 1, 2, 3, 4, 5 as much as it is where you're going to flow back and forth between the 5 R's.
That was a great response. And kind of stemming off of that, we have an anonymous who says, I've already been diagnosed with Sibo, but I'm looking for professional help to start the 5 R's. Would the best person to see for this be the nutritionist on your team? If so, do you conduct virtual visits? So the providers here would be the first point of contact for evaluating you and your medical concerns, your symptoms. And Erin is a very key member of our team who has so much knowledge when it comes to different food plans that can be helpful if you have Sibo, low Fodmap, transitioning off. These are very tricky things to do. And so many of our patients right now are under her guidance and her care about how to very carefully do this, so that way we do not have the reoccurrence of Sibo, which, as we talked about tonight, is very common, unfortunately. So you would first be seen by a provider, myself, Linda, Dr. Tetlow, and then we can certainly bring Erin on as a key part of that process. So hopefully that helped. And we also, let's see, had a separate question. Yes, Dr. Tetlow.
Yep, I just wanted to say, Stephanie Morgan, sorry, Stephanie, I'm supposed to say your first name only. I apologize. Let's protect your privacy. Stephanie, how do I figure out if it's Sibo? What are the symptoms I'm looking for? What are the primary things that make you think, oh, clinically, this sounds like Sibo? Because there's so many things that could be associated symptom-wise. And I would say the primary thing is abdominal bloating. So it can be abdominal bloating after each meal, and sometimes people will have a baseline of bloating around the clock. So that's a little red flag for me. And the other thing is the person having those types of symptoms, and do they have, you know, it's often associated with, there's some type of motility dysfunction. They might have chronic diarrhea, or they might have chronic constipation, or they might have that more IBS picture where they're alternating between diarrhea and constipation. There's definitely motility going on. Those are things that are red flags for us. And you would be surprised how many people with Sibo have joint pain. There's just these toxins and these gases that are being exhaled, but also the system is absorbing some toxicity, and there is physical body pain. And so I would say those were the chief things. Of course, you get better intuitively, and then there's nothing like getting the test to confirm and bring in other information that you might have intuitively been wondering but need confirmed. Great question, Stephanie.
There's a question from Allie here. I'm a current patient, was diagnosed with leaky gut. The 5R approach to heal leaky gut sounds the same as the approach to heal Sibo. Do I need to have a Sibo test, or does the 5R approach heal both issues? Yes, it does heal both issues. And that's where I was saying the 5R is just a real general approach to gut healing overall. And so we use that with the small intestine, we use that with the large intestine, whether it's inflammation, leaky gut, bacterial dysbiosis, overgrowth. So it depends on how your symptoms are and how you're doing, whether we would think we needed a Sibo test, or if we're really addressing inflammation and leaky gut. Very similar. It's the details of what we do in each of those 5 R's that apply to different situations, but a lot of overlap.
And I can answer 2 questions at a time. So Julianne has a question about which type of zinc do we prefer to use for gut healing? Is it zinc glycinate? Is it zinc picolinate? Is it zinc carnosine? And zinc carnosine has some specific qualities for gut healing and gut repair. Zinc carnosine has literature for healing eosinophilic esophagitis, which is a very specific localized inflammation in the distal esophagus involving eosinophil pathways. And zinc carnosine is actually acting more locally. So in terms of absorption, for systemic absorption, if we're looking for a serotonin precursor, we're trying to get that zinc absorbed into the blood where it can be active to help to promote serotonin levels. Zinc glycinate is very easily absorbed. I think zinc glycinate is better absorbed than zinc picolinate. If you take a zinc glycinate, you're getting a glycine molecule, and that can also be helpful because glycine is very relaxing. And glycine is one of the 3 amino acids that makes glutathione, right? Glutamate, glycine, and cysteine are going to make glutathione. And so that's also a helpful antioxidant promotion. Hope that answers that one. I love the question from Catherine. Thank you, Catherine. So I think I might have just accidentally made it disappear, but the question was, is there a graphic to show us what is happening for Sibo? And this is such a great question because the small intestine is not actually a place where you can go and look, right? So if you have a camera and you're a gastroenterologist and you want to do an endoscopy, you're going to put that camera and look through the esophagus and the stomach, but you can only go so far in the small intestine, and then you can't look any farther. And if you do a colonoscopy, you can come up from below, but there is this part that you can't actually see. And that's why there's a brilliant discovery of a breath test, which is looking at that substrate and then exhaling of the gases, which is giving us an indication of the small intestine, because before that breath test, we didn't know what was happening. And of course, breath tests are looking at bacterial overgrowth. We don't have a test to look at fungal overgrowth. SIFO, small intestine fungal overgrowth. So we tried to show you a bunch of slides that look at the causes. And so in terms of a graphic that looks at what is Sibo, where does it come from? Motility is such a big factor, and also the formation of gases. So motility is, we can show that in different images, but it's also, there's other ways to discover it. I don't think there's a lot of great visual images that are going to show motility as a concept. But it's a great question. And actually looking at a Sibo test result, as you understand the parameter of what's showing, is actually a great way to see, gases are rising in the small intestine. They shouldn't be. We shouldn't have bacteria there. We should, especially interpreting the test according to the motility of the patient, right? So we're making sure that test is interpreted properly, but that picture is a helpful, I love the picture of the Sibo test, and I love explaining that to patients. So we are 100% virtual practice. So one of the things that's become so much easier with our patients is we share our screen and we show them their test result, and we show them the carbon dioxide levels to show you breathed into that tube and there's carbon dioxide in it. This is a valid test. And then we look at the motility and we ask about how frequent their bowel movements were, and we interpret the test properly. And then you can see your test, you see the visual, and it's not actually just a schematic, it's actually your body's biomarkers. Thanks for that question.
There's a question from Anonymous about our favorite lab for stool testing. We use Aerodiagnostic. There are other labs, but Aerodiagnostic happens to be the lab we use. There was also a question about a minimum age for a Sibo breath test. So part of the thing, you have to be able to do the test. And it's very tricky. You have to blow into a tube and catch the air. And so I think it's a lot about not, if someone, at what age could someone have Sibo, but could they actually do the breath test? And then there's also a question about practitioners in California. And I think you can go to the Institute of Functional Medicine, you can go to the University of Arizona, Andrew Weil School of Integrative Medicine, and look, and you'll see practitioners that are in different parts of the country. And so that would be, if you're looking for someone in San Francisco, would be the recommendation there.
It looks like we also have a question from Amber. If you have a patient who is malnourished and has lost 20 pounds at 13% BMI and has Sibo, what diet do you recommend? They're not tolerating any food well without multiple GI symptoms. This is something that we would encourage, a person that we would encourage to seek medical treatment. A BMI of that low requires very careful dietary intervention. So this is somebody who will likely need to be hospitalized to receive proper nutrition. We also have a question from Anonymous. Have you seen connections between Sibo and eating disorders? This is something that we're very sensitive to, and it certainly, that connection certainly can be there. Perhaps with binge eating disorders, this can certainly be, Sibo can be more prevalent, but we can see those connections when we think about the timing of eating and thinking about regulation of the migrating motor complex, and disordered eating can certainly influence these things. And then there is also another question here. How do you determine, this is from Bonita, how do you determine if someone has hypochlorhydria? How is it treated? This is a good question. Hypochlorhydria is low stomach acid. This is something that we can detect in a GI map. This is something that we can look for, determine if we see the presence of H. pylori, which is suppressed by sufficient stomach acid. So if we see this, we know that that is one indication of low stomach acid, although this would be more moderate to severe. Also, we can look for pancreatic elastase in a GI map. And typically, if there's not enough stomach acid, because that is a chain reaction in the body, there will not be enough digestive support and not enough pancreatic elastase. There are other tests that can be done to look for acid production in the stomach, but that stool test is a great catch-all test that can look for so many different areas of dysbiosis, including hypochlorhydria. And there's a lot of very simple and foundational ways that we can treat that. Linda talked about some very important tips tonight, including eating hygiene. So I encourage you to check that presentation again tomorrow and just kind of refresh on that. So thanks for asking, Benita. Hopefully that helped.
A question from Veronica was about, is there a timeline with the 5 R's, that 5R approach? And is it realistic to do one step at a time, only do one step at a time? So we always personalize our protocol to who is with us, who is in front of us, to our patient. And so if someone has a tremendous amount of stress, or we find out that they have really very small and shrunken microbiome, not a lot of beneficial bacteria for various reasons, multiple antibiotic courses, or they have a genetic issue, there are genes that are associated with not being able to maintain adequate microbiome. If those are issues and reinoculation with bacteria is a key issue, we might start there, but very often we'll do multiple steps at the same time. If the person doesn't have enough stomach acid and its secretions, and its R is for replace gastric secretions, then we're going to be doing multiple things because we want to help that person to digest and assimilate. And actually that's part of the process of healing. If your liver and your organs don't have those nutrients to make gastric secretions, you need to do some of that replacement of gastric secretions so you can do that absorption and then start to make your own. And that's very important for motility, which affects the microbiome. So everything is connected, and we pick up one piece, we pick up it all, but we like to make sure we personalize our care and also follow with you to make sure that we're not causing harm and that you're getting better as fast as possible.
Another question from Linda. If a patient has a GI map, does one still need a Sibo test? This is something that is determined by the provider. This is something that is very carefully considered for that patient. Are their symptoms more consistent with Sibo or perhaps another sort of dysbiosis? Maybe at some point, maybe the Sibo test may be necessary. But again, that is something that is determined with your provider. And that's really the joy of it, is to know that you have someone who has experience and training in these sort of areas that can use their discernment to help you choose the best first test for you. Another question from Jennifer, can the GI map test be done from home, and can you share the cost? The GI map test can be done from home, which is why we love to use it. We can ship it right to our patient's home, the test kit, and then they ship the test right back out. And pricing can be discussed if you choose to be established as a patient or decide to do a free 20-minute consult. We would be happy to share those details.
So I'm looking at a question. We're at 9 o'clock.
Yeah. So why don't we choose, I'd like the providers, and Linda, you're a mid-sentence. I'm so sorry to interrupt you. There's no reason for me to interrupt you. I'd like maybe us as providers to choose one more question each. And then we're going to wrap it up because 9 o'clock, it's time for us to finish. So let's choose one more each, or if one you want to answer quickly, 2 quick questions, but let's finish this up.
So I've got a couple of questions here on Xifaxan. Is the elemental diet recommended when taking Xifaxan? We don't normally use those together. And if a patient has constipation, should neomycin always be given? That depends on the results of your breath test. And then another anonymous was prescribed Xifaxan by their gastroenterologist, but not tested for Sibo. Will it affect the good bacteria? Xifaxan does not affect the healthy bacteria in the large intestine, but we do like to have a Sibo test to know what we're treating and to know if it worked. And so those are mine. I'll take.
Yeah, so I'll just answer a couple things real quickly. If you're thinking about a probiotic, lactobacillus and bifido dominant probiotics that have about 7 strains or less are actually safe to use in Sibo. Biofilm disruption can be very important, and so sometimes we use something gentle like oregano oil or enteric-coated oregano oil, or other of those essential oils are actually very, very helpful for less invasive and gentle biofilm disruption. And we do use iberogast, and we do use motility activated by Integrative Therapeutics. And also we reestablish eating practices. How are you eating? And are you enjoying tasting the lifestyle piece is really key. So that was my last question.
All right, and let's see, one from Mary. I seem to be pretty well healed in my gut, doing many of the things you mentioned tonight, but I seem to be dehydrated quite often, even when I drink enough fluids and feel that I'm not absorbing food as I should. Do I ask my colon doctor for a Sibo test? I only had a test for C. diff after 22 days of antibiotics. This is a great question. Some conventional GI specialists are conducting Sibo tests. However, after hearing tonight's webinar, I would encourage you to, if this resonates with you, pursue a more integrative or functional approach where you can be looked at as a person and know that the providers have experience in all sorts of GI concerns and areas of dysbiosis, including Sibo, including how to interpret, and including how to prevent the Sibo from reoccurring. As we shared tonight, this is something that can certainly reoccur, and we want to help prevent that. We want you to get better and to stay better. So I would encourage you to think about an integrative approach if tonight's webinar was helpful to shed some light on that.
Are we at that point where we're getting ready to wrap up our webinar? Yes, we are. I'm getting that. An absolute yes coming from Linda. So I'm going to say thank you so much for your very wholehearted participation. I want to say that one of the things we really care about is helping every healthcare provider be supported and receive answers to their questions and have the collegial support, which is what we cherish in our own practice and what we do every day. And we are here for you as the general public to help to empower and educate you to see how powerful and how extraordinary and what a gift our body is and how it works, so that you can support the natural intelligence of your own body and its working. So we hope that this evening has been helpful. I really want to appreciate Linda for the amount of preparation, the expertise which you brought tonight. Linda had an 100% full caseload today, and then she showed up for her webinar and taught us for hours. I want to thank Nicole for working as our key administrative staff member. Zoe, we first started our morning at 7:30 for our provider call to discuss patient care with Erin, our nutritionist. And thank you all so much for this evening. And thank you for the sources and the places you've come from. Some of you are at the University of Arizona teaching sessions we've done recently. And We look forward to seeing you for our next webinar. Linda, the date for your insulin resistance webinar is November
11th. The
November
11th.
11th, 7:30, same place, same time. And we'll be here. We hope you are too. Please help us spread the word and also share this with friends and family who are wanting to understand what they can do for themselves. That's what we're doing tonight. Thank you so much, and we hope you have a very pleasant night and you can relax smoothly into your evening and get a good night's rest and feel renewed and supported. Take care.
Good night.